We're all finding out about our coworkers getting sick, gravely sick. We're afraid for our patients. We're so sad to see folks dying in our ICUs with no family around because of the no visitor policy. And I think at this point, many of us are enraged.
Trey Kwan is one of the nurses on the front line of New York's coronavirus outbreak.
So I just had a baby. She's almost 100 days old. I wouldn't have cut my maternity short if there wasn't a pandemic, if there wasn't a severe shortage of nurses, if I didn't hear my coworkers telling me how they're crying every day, how they're stressed, how they feel like they need more support.
New York City is known for its resilience. When tragedy strikes, first responders and medical staff always rise to the challenge. But now, with more than 45,000 cases, the coronavirus is stretching emergency crews to the breaking point.
How can I describe it? There's so much tension, so much anxiety in the air. The thing that kind of is covering like a heavy blanket over everyone, over the entire hospital, is this: we're being overwhelmed. Hearing stories from nurses who floated here, immunocompromised, and their units are filled with COVID patients who are not all older, you know, and talking about the deaths, the deceased, the sadness, the stress.
The U.S. now has more cases of coronavirus than anywhere in the world, and nowhere in the U.S. has more infections than New York City.
Many of the floors in the hospital have been turned into ICUs and other respiratory units as well.
Not only are we risking our own lives, but we're also risking the lives of the ones we love.
Government officials are scrambling to deal with this unprecedented health crisis, buying resources from overseas, building field hospitals, including in Central Park, and flying doctors in from across the country.
The immediate problem in New York City were the supplies, the masks, the gowns, etc. We've been working very hard to find and buy supplies all across the globe.
But for some, the efforts are too little too late.
To be honest, I wasn't terribly surprised when I learned that I myself was diagnosed positive with COVID after developing some respiratory and some other viral-like symptoms. So I've been using a single mask all day. I came home, took off my mask, showered, took a nap, woke up, and had a fever.
And because there's a shortage of doctors, many are being asked to come back to work quickly after recovery.
Around 72 hours after our fever subside and our symptoms begin to improve, we could be asked back into the hospitals to continue working.
Healthcare workers say they're at a high risk of being exposed to the virus at work.
Reusing masks, you're careful how you take it off. You're just kind of hypersensitive. And then at the same time, you're like, well, what's the point? You know, I feel so exposed after 3 months of this. How will I not contract this illness?
Medical staff rely on personal protective equipment to keep themselves and their patients safe.
For example, this is an N95 mask. The mask is created to create a nice seal. It's supposed to be fleshed with your face so that we help to block out any particles that could seep in. I have this nice little shield here, ready. And so we'll put the N95, we'll put that on, and then we put a gown on, and then lastly, you'll put your gloves on. And that is what we call donning on of PPE equipment that you have to do every time you go into a patient's room.
And New York, like so many other states, is facing a shortage of not just PPEs, but other essential supplies, like ventilators, hospital beds, and ICU facilities.
My coworkers are people that I love and care about. We have been in intense situations before. We've banded together so many times, and I feel like this is just another time where we have to continue to do that. If we start to lose, soldiers in the battle, I am definitely not one of the ones that should retreat.
This is unlike other disasters, hurricanes, earthquakes, floods. They happen, they're fast, they're over, you start rebuilding. This is different. This is ongoing, and the duration itself is debilitating and exhausting and depressing.
Experts say New York could still be weeks away from seeing a peak in infections. Until then, frontline workers say they'll continue to demand the tools they need to fight.
Given the situation, I think New York was grossly underprepared for what hit us.
What we could have learned as a country is to look at the other countries around us to say, hey, China got hit with this exponentially. Maybe we should stockpile our hospitals in case.
So if the rest of the states don't take the warning of New York, they're going to become another New York.